Hi, today I'm going to talk to you about what is complete decongestive therapy, CDT. Sometimes it's called complex decongestive therapy, but usually it's complete decongestive therapy. This is for people who have lymphedema and they go to a clinic or a private practice office of a massage therapist, physical therapist, or occupational therapist, as long as that therapist is a certified lymphedema therapist. So it's a great way to manage your lymphedema. And during the session, usually it's an hour, the therapist probably will start out with some MLD, manual lymphatic drainage therapy, very gentle therapy where we stretch and release the skin rhythmically in different places on the body, especially on the area that's swollen with lymphedema, to try to get the lymph fluid out of the swollen area. Let's say it's a leg, and that in turn will decrease the stiffness and pain. They also at regular intervals will measure, again if we're talking about a leg, they take a regular measuring tape such as the flexible kind they use with sewing, and they will keep the numbers documented in the computer, for example, computer program, or on pen and paper. They'll measure both your legs, and they want to get a baseline, of course, and then a comparison, and hopefully over time, over the next several weeks when you see the therapist, your numbers of the leg that is the limb that's involved with lymphedema, hopefully those numbers are going to start going down. That's the purpose of this. They also will each time bandage you and wrap you with a variety of foams and bandages. So for example, this is a piece of foam they might use. They will cut it so that it wraps nicely around your leg, smaller for the arm. We've got some of these, using lots and lots of different kinds of bandages, different sizes, depending on what your situation is, what your body's doing. But a lot of bandaging, including these. You might be more familiar with the ACE bandages. And all the way up the arm or all the way up the leg. We can cut foam like this. These would go on either side of your ankles, so you don't have sharp edges and you don't have rubbing on the skin. So that takes some time to do some bandaging. And you come out with your leg or your arm wrapped like this thick with all these different bandages. But it's so important to get the limb volume down. And we suggest that you keep all of those bandages and wraps on 23 hours a day. And you can take them off, take a shower, do some skincare. You've got to put them back on. We also give advice to the patients on dieting. Sometimes lymphedema patients are obese and it makes the lymphedema worse. They'll find that their symptoms subside a bit if they lose even a few pounds. So changing up the diet is very important. Starting a home exercise program is really important. And then skincare, as I mentioned before, some tips on how to keep it nicely moisturized and clean and dry. Also, we give education on what's called risk reduction practices. So if you've had lymph nodes removed or irradiated, they're damaged or they've been taken out, your immune system is ever so slightly depressed. So you need to be very careful for the rest of your life on trying not to get sick and try to avoid people who are sniffly and coughy. And so we talk about what are the risk reduction practices. You also want to be careful, because you have a slightly depressed immune system, not to cut any place on your skin. Try to avoid bug bites, try to avoid nicks on the skin when you're doing the dishes or doing the gardening, anything like that. It's really important not to walk around barefoot too much. You might get cuts on the foot, and it's it's maybe easier for you to get serious infections and heal more slowly once you do get any kind of sickness. So it's all kind of advice like that. So these are the components of complete decongestive therapy.